My name's Brian Reiter. I'm an orthopedic surgeon here in Palm Beach Gardens. Also, we have an office down in Lantana. I specialize in sports medicine orthopedics, predominantly knees and shoulders. The focus of my practice is mostly arthroscopic, sports-related injuries, knee and shoulder pain. My mother's a nurse, so I sort of grew up in a household of my mother taking care of patients and hearing the stories and sort of watch her interact with not patients always, but even family members, and just how she was with people. I was always impressed by that, combined with the fact of I was always drawn toward the science side of school. And when you look at what types of things were interesting to me, I felt that a career in medicine would be rewarding. I felt like there would always be a need for doctors, and those ideas never really change. You just get further and further along in the process, and you realize I really do enjoy doing this. In medical school, when you get through your third and fourth year, you try all these different specialties to sort of test the waters of what you might be interested in. And honestly, it came down to emergency room doctor, an ER doctor, or orthopedic surgeon. And I think what ultimately helped me decide was I wanted to know how they did. And the one thing that emergency doctors are great at is treating the emergency when it comes in, stabilizing the patient, and treating such a wide variety of problems, which is the appeal. The downside for me was that I never got to see, did everything I do, all that hard work in the emergency room to maybe save them or stabilize them, how did they do after that? How did they do a month later, 2 months later? Did they recover completely? So I think ultimately I chose orthopedics because it was more of a beginning of a story and an end of a story, which for my personality type, I think fit a little better. The variety of patients that I come across, for sure. I can't understand how people can go to work and not have the social interactions that I get to have every day. That's the part of medicine I really like, meeting the patients, and everybody's different, obviously. And as much as the human body can be similar, every patient is different and their goals are different. So I'm a big fan of puzzles and riddles and things like that. And I think medicine in general, each patient that comes in is a unique puzzle, not just because of their injury, but because of the person and because of what they're looking to achieve. And I think the best approach that a lot of us try to adopt now is called a shared decision approach. Someone may come in with an MRI or an X-ray or a history of a problem. And as an orthopedic surgeon, I can say, well, here's what you should do, here's what the textbook says, here's what the percentages are, here's what the research, and here's what the data says. But what shared decision making is talking to the patient and finding out, well, what are your goals? Not every patient needs surgery for this, and certainly not every patient needs surgery for this right away. And sometimes I come across a patient, and most of the time, in fact, you come across a patient that says, if there's conservative treatment that we can try first, physical therapy, medications, bracing, just giving it time to see if something can heal on its own. The body can heal a lot of things on its own. And trying all the options that are available and within reason. Now, as a caveat, there's obviously a lot of marketing out there for conservative treatments that aren't necessarily backed by the American Board of Orthopedic Surgery. And I get questions on alternative medicine all the time. And I'm certainly a fan of alternative medicine in that it can work. You just have to really do your due diligence to make sure that there is some good scientific research behind it, and you're not wasting time and money on those things. And on the flip side, sometimes I get a patient who gets injured at work. Maybe they tear a meniscus or an ACL or a rotator cuff, and they're young and they're healthy, and the likelihood of that patient going the rest of their life without a functioning ACL or with a torn meniscus is low. And as a physician, I know that this is a patient who is highly likely going to need the surgery at some point. And some patients come in and say, Doc, if this is what I'm going to need eventually, I don't want to delay things for 5 or 6 months, then have the surgery. I need to get back to work, particularly my athletes. I need to get back to next season. So timing is certainly very important. And each individual is different in regards to what timing works for them, their busy season, their slow season, what they do as an occupation. So we factor all of that in how we decide what's the best treatment option for that patient, not just what is the best treatment option for that injury or for that syndrome or for that disease. When you treat sports medicine, orthopedic surgery, or when that's your training and fellowship, it doesn't mean you just take care of athletes, but it's sort of a subset of injuries. I do like ACL reconstruction surgeries. I like ligament surgeries in the knee in general. I do like meniscus work, which is sometimes meniscus repair, sometimes meniscectomy. I also enjoy cartilage work. There's actually some very fancy technologies that we've had now for over 10 years where we can regrow cartilage in certain spots. And I enjoy those procedures. Similar things for the shoulder. I enjoy rotator cuff repairs, shoulder dislocations. Those patients are very rewarding because that surgery is quite a successful surgery. And mostly in general, taking care of a patient with an athletic injury to a knee or shoulder who wants to get better. And that's the benefit of doing sports medicine, is that most of these patients, whether they're athletes or laborers, or they just want to get back to their weekend pickleball, golf, tennis, whatever it may be, they want to get better. So they're working with you to get back to what they want to do. And it's really nice and easy working with patients who want to get better. They're willing to do the therapy, they're willing to listen to your suggestions and willing to have the conversation about how we get them back as close, if not to 100% if possible. So I'm not at work, I have a family. I have a wonderful wife and 2 kids, now 12 and 11, and they're in activities and they're full of spirit and just as amazing as they can be. So when we get a chance and I take a little time off, they love to travel. Recently we've been doing outdoorsy hiking trips and those type of vacations, and it's wonderful to see them grow as kids. That fills a lot of my day. I do like to exercise. I try to practice what I preach as far as strength and flexibility and just an overall healthy lifestyle. So I do try to practice that, and that's a little time consuming as well, but very enjoyable. I think it's important for patients to know that it is okay to ask a lot of questions. Procedures change all the time. Technologies change all the time, whether it's nutrition or whether it's augmentation patches for the shoulder, different ways we can augment healing ligaments in the knee from surgery. There's a lot to navigate there. I try to keep up on not just what's new, but what's new and actually has research and evidence behind it. So that I'm not the first person, trying something new, but I also don't want to be the last person in the area doing something. So I do think it's important to keep up with what's current and where the research is heading.